you.
Hey, Mayor, how are you? How are you?
Yeah, this is intimate. Look, you see what we're doing here.
The shoes.
You like this?
Well, yeah. What do you think? Look at you. I want to emulate you.
You're up. You're first up.
Am I up now?
Yeah.
Are we going?
Yeah, we're going. Showtime.
All right. Showtime. Well, good morning, everybody.
Morning.
It's a really great day for Morristown. Have the governor here and Senate Majority Leader and my good friend Assemblyman Raj Mukherjee. Let me just give a couple of quick announcements for people that are here. I'd like to announce Eva Turnbeiner, President and Chief Executive Officer. She's here. Fran Palm, Chief Operating Officer. Dr. Rena Ramirez, Chief Medical Officer. Dr. Douglas Bishop, Assistant Medical Director. Shade Cronin, Foundation Director. Where are you, Shade? Oh, she's out and back. And Bill Schuller, Board Member. But let me just say a couple of words before I introduce the governor. Please have a warm welcome for our Senate Majority Leader, Teresa Ruiz, and and Assemblyman Raj Mukherjee to her left. It's always nice to have distinguished people from our state come to visit Morristown, so welcome to Morristown. Thank you for coming here. Now, the reason why we're here is I get the luxury and the honor and the privilege to introduce our great governor of the state of New Jersey. Governor Phil Murphy has done a lot for this state, and as I dig into more of what he's accomplished here, really is something special. To have health care for children is so incredibly important to our state because we're so compact with people that it is amazing when you think about what goes on in this whole nation and in the world that this governor and our leaders in the Senate and the Assembly got together and pulled this off and did something amazing for the children of the state of New Jersey. I can't tell you how proud I am to stand here in Morristown and introduce this governor and his leadership and what he's able to accomplish for all the residents of New Jersey, and especially here at Sioux Fall. Sioux Fall, when they first came here, what they've accomplished on all the people they treat, and the minorities they treat, and the people who don't have anything they treat, and this is what it's all about. It's about protecting children. It's about protecting citizens. It's protecting people who don't have what a lot of us do have. So it is my privilege and my distinct honor to now introduce the great governor of the great state of New Jersey, Phil Murphy.
Wow. Am I okay to take my mask off while I speak?
Yes.
Is that okay?
Yep.
This was a shameless promotion for the Buffalo Bills. I don't have such an equivalent mask. I'm all in black today. Good morning, everybody. It is a real treat to be here, and a special thanks to my friend Mayor Tim Doherty. Thank you so much for welcoming us so graciously to historic Morristown, truly one of the quintessential Jersey communities. How long have you been mayor, Tim?
This is since 2010. So.
I mean, come on, let's hear it for the mayor here. You don't get that every day. And a huge thanks to the team here at Sioux Fall Health, which is also one of the iconic institutions in this state. I want to thank Eva and Fran and the rest of the team, your fellow staff members, your board members, for welcoming us so graciously this morning. I'm also honored to have my colleague, the Commissioner of the Department of Human Services, Sarah Edelman, with us today. Sarah, always a treat. The aforementioned Rockin' Senate Majority Leader, Senator Teresa Ruiz, honored Senator, and in all the way from Hudson County, Assemblyman, and with a little bit of luck, future Senator Raj Mukherjee. Great to have you, Raj. And Amy Torres is with us, who's the Executive Director of the New Jersey Alliance for Immigrant Justice. And Amy, we're going to be hearing from you in a few as well. So great to have you with us. So 2 years ago, through the state budget and in partnership with the legislature, we committed New Jersey to a simple yet I think profound principle that no child should be left without access to health care coverage. To accomplish this goal, and in partnership with our great legislative leaders, we instituted a program we called Cover All Kids. This has been an effort to bring coverage options to all those children who were previously without health care coverage. We began with those children who were eligible but were not enrolled into New Jersey's already successful NJ FamilyCare program. And we are proud to advance this initiative to now ensure that those children whose families are currently Medicaid eligible income-wise will not be shut out due to their undocumented immigration status. This is a huge, huge step today. After all, this is not called Cover Some Kids or Cover Most Kids. This is called Cover All Kids. By the end of 2022, the Department of Human Services, under Sarah's leadership, had enrolled more than 47,000 children, many of them getting health care coverage for the very first time. This means 47,000 children who can now regularly see a pediatrician at places, by the way, like right here at Sioux Falls, or if necessary, as kids can be kids, we have 4 of them, visit an emergency room, please God no, without their families wondering how that bill is going to be paid. But through this expansion today, we're going to reach out to bring in roughly 16,000 additional children, again, whose families are currently Medicaid eligible income-wise, yet have been shut out due to their immigration status, and we'll bring them into NJ FamilyCare. We will now work through the Department of Human Services in partnership with our tremendous network of community partners to reach these families and to enroll these children. This is not just the right thing to do morally, but it is the right thing to do for the future health of our state in all the forms that health takes. Moreover, investing in regular and consistent health care coverage is an investment in peace of mind for all New Jersey families. It is also an investment, by the way, in consumer choice as they search for quality providers best suited for them, as opposed to just having that narrow lane of the outstanding, by the way, federally qualified centers. It now broadens the palette for these families and for these kids. I'm extraordinarily proud of the impact Cover All Kids is having for the children of New Jersey. In a state as wealthy as ours, a state which claims unrivaled leadership in health care, we cannot leave any child without vital, life-improving, and potentially life-saving health care. And when I present my budget proposal for the next fiscal year to the legislature, in less than 6 weeks, folks, stay tuned, you can bet that this commitment to the health of every child in New Jersey will be written in black and white. By any measure, Cover All Kids has been a success. Yet we know our work will not be done until every child who lives in New Jersey has health care coverage. A healthy start, and we all know this, is among the very least we owe to the next generation of New Jerseyans. And again, my thanks to the team here at Sioux Falls, Eva and Fran and the rest of the team, for allowing us to take over their space today, this intimate space, I might add, and for all they are doing and so many of their peer groups around the state to look after the health and wellness of New Jersey's kids. And with that, it is my honor to introduce my colleague, the Commissioner of Human Services, who, by the way, hold on, Sarah, made history because we're the first state in America to allow free and anonymous distribution of naloxone through a pharmacy anywhere, anytime, to help fight against the scourge of the opioid epidemic. And Sarah, that's your leadership. Sarah Edelman.
Thank you, Governor Murphy, and good morning, everyone. I am incredibly excited to be with you today to talk about our administration's Cover All Kids initiative. As the governor just shared, since we launched Cover All Kids in July of 2021, we have enrolled 47,000 more children in healthcare coverage in New Jersey FamilyCare, our state's Medicaid program. And today, New Jersey FamilyCare provides health insurance to nearly half of New Jersey's children. We have achieved this in several ways. We removed 2 of the biggest barriers to getting and keeping coverage. First, we eliminated premiums for children. And second, we eliminated a 90-day waiting period for coverage that left children and their families unprotected. And we focused on partnerships that helped us reach families. In partnership with the state treasurer, we used information from tax filings to reach out to families who indicated they had uninsured children and to offer to help connect their kids to coverage. In partnership with the Department of Education, schools helped identify uninsured children during school enrollment, and we reached out to those families to help connect their kids to coverage. In partnership with the Department of Banking and Insurance, when families sign up for healthcare coverage at Get Covered New Jersey, the state marketplace, if children appear income eligible for New Jersey FamilyCare, we work together seamlessly to help enroll those kids in coverage. And it's in partnerships with organizations in this room and up and down the Garden State. For instance, at federally qualified health centers like Sioux Falls, our gracious host today, they employ staff who help begin the enrollment process for New Jersey FamilyCare for uninsured children who present in their facilities for care. And the leadership at Sioux Falls told me just this morning they've enrolled 4 more children. And organizations like both Sioux Falls and Citizen Action, who join us also today, who serve as enrollment navigators and assisters for Get Covered New Jersey. These navigators help individuals and families find affordable coverage that best meets their needs, which is sometimes through New Jersey FamilyCare. It is in partnership with the New Jersey Consortium for Immigrant Children and other immigrant and faith-based organizations who are trusted voices and sources of information in communities and who can sometimes reach people better than government can. And beginning this month, we embark on the second phase of our Cover All Kids initiative. As of January 1st, all income-eligible children may now enroll in New Jersey FamilyCare, regardless of their immigration status. It is the same application. It is the same application. It is the same insurance coverage. It is the same access to a network of doctors and hospitals. It is the same medication as every other child. This is a monumental step forward to ensuring healthcare for all children. Healthcare for kids is so fundamental. It is a moral issue. How we care for our children is a reflection of our values, and it is a fiscally responsible decision because investing in the health of children, particularly in primary care, pays dividends over their lifetimes. It makes our families and our communities healthier and stronger. So I want to thank you, Governor Murphy, for your commitment and support of this initiative. I want to thank the members of our Cover All Kids Outreach and Enrollment Working Group, our county boards of social services, our legislative district offices, and our Office of New Americans team. I particularly want to thank our Medicaid Director, Jennifer Jacobs, and Deputy Director, Carol Grant, and Maria Terlecki, who is with me here today from our Medicaid team, for their phenomenal work turning this vision into a reality. I talked about our many partnerships in this work because, and as the adage goes, caring for our children takes a village, and I am filled with pride and gratitude for this village. So thank you to each of you for your role in this work. Together, we are making sure that every child in New Jersey has access to the health care that will give them a stronger start in life. So please enroll today. We have a team with us here today who can help assist you. Folks can call or visit us online, visit family care offices or county offices across the state, or get help from dozens of organizations statewide who are here to help. Thank you.
Thank you, Sarah. SiouxFallsHealth.org. I hope you didn't have to hire a bunch of consultants to come up with that website even. But this is a great organization, and why not enroll for you all right here. Thank you, Sarah, for everything you do. So you mentioned it takes a village, and we don't get to today without great support from our legislative colleagues and leadership, and we have 2 incredible leaders with us today. Please, first up to bat, help me welcome the Majority Leader in our Senate, Senator Teresa Ruiz.
Good morning, Governor, Mayor, my colleagues. First, I'd like to give a shout out in absentia to Senator Vitale, who was at the forefront of this discussion in a very long time, and understanding that investments in healthcare across the board in children and families pays back the return extraordinarily. So on Thursday, I get a phone call, like many parents do, that my daughter's throat was bothering her. So running to the school, pick her up, and as everybody knows, this viral circus that we're going through with our children, it'll go from 1 hour of having a sore throat to 2 hours later being completely congested, fever, and the whole nine. Take her to the doctor on Saturday, not getting any better, take her back to the doctor on Monday. When you think about the opportunity that I had to call my pediatrician, to make an appointment, to swipe my insurance card, to just give a de minimis copay, and then to put myself in the lens of a woman in my neighborhood, doesn't speak the language, doesn't have access to health care, may not have the $10 in her pocket to have the copay. She ends up in the emergency room. And what does that do? I mean, we all know that that just creates an extraordinary backlog, and it doesn't fundamentally get to the core of making our children healthy in a long-term way. And so today's announcement is, people, I think later, Governor, you think they'll probably talk about, why are we spending money? Every time we have a policy decision that is surrounded and engaged by children, for children, it is always and consistently an investment. Today is an investment in the greatest asset that any state in this country has, and that's the next generation of leaders. Making sure that New Jerseyans are healthy has the greatest returns that you can ever possibly imagine. Making sure that a child has access to health care promotes their well-being and academic success in the school system. I mean, the barriers get eliminated. Everything you can keep pointing to, and I can be here for 7 hours, Mayor, and the governor will not be happy about that, and all of you will not be. But when we talk about children and making those investments, I mean, we can argue over and over or have a fundamental discourse and discussion that this is the most important thing that any public servant can commit themselves to. Eliminating any kind of financial barriers and the time frame. It used to be 90 days. I remember getting phone calls at the county when people would sign up and getting the Frank to call, my daughter's sick, I still don't have access to it, and trying to accommodate them at a FQHC or making an extraordinary, but eliminating all those barriers so that today, when a parent brings in their child and enrolls them, regardless as to status, you know, people forget that everybody loves to get up and say, New Jersey's greatest component is our diversity. Well, that's great if you say it, but if you don't walk the walk and talk the talk supporting it like the governor does, then it's just hearsay. We are diverse. We look different. We love differently. Each one of us, you know, has a different accent. We come from different geographic locations. We eat differently. But understanding that making a policy that invests in all of us, because we all contribute to the economic fabric of this state, is the most important thing that we can do as a government. And I'm just honored to be here today to share with all of you, thanking this organization for opening your doors, recognizing the constituency as soon as you walk in español, usen la mascarilla antes de entrar. I mean, siendo una inversión en nuestras comunidades hoy de parte del gobierno y de todas las comunidades. Para cada dólar que se da en nuestro seguro, en nuestro ser de nuestros jóvenes, las oportunidades de nosotros a tener nuestras comunidades sobrevivir en estas épocas, no tan solo como tú eres ciudadano, tú no eres. Todo el mundo va a tener una oportunidad a tener el seguro médico, que es tan importante. So thank you very much. Did you get all of that?
I got all of it. Teresa, your Spanish is outstanding.
It's not that great.
Okay. Listen, I want to make a serious point before we bring Raj up, and you made the point, Sarah did, I think Tim and I to a certain extent did as well. This is right at so many levels. Obviously, it's right for the kids who will be impacted. A dollar in their education, a dollar in their health care early on yields many multiples over the course of their lifetime. We know that. But beyond that, it eases the burden and strain on our federally qualified centers, which are outstanding organizations, but they're overrun. It eases the burden on our emergency rooms. It makes the state in total stronger. It's sort of a tale of two emotions here. One is pulling at heartstrings because these are our precious kids. And at the other end, it's cold-blooded. We know what works. We know what the data says. And for all of those considerations and everything in between, this is a no-brainer. Senator, thank you for your steadfast leadership. all the way in from Hudson County, another great leader, in this case, at least for the time being in the Assembly. Please help me welcome the outstanding Assemblyman Raj Mukherjee. Raj? Nice to see you, buddy.
Confiar en el español del senador Ruiz. Su español es mejor. Yo soy indio, yo soy hindú, pero mi corazón es hispano. This is a special day, and I can't overstress the importance of the January 1st effective date. The first phase of Cover All Kids, which is a program that earns its name this month, has been removing barriers to CHIP. And CHIP, we really owe Joe Vitale for the early iterations of CHIP and taking it to what it is in our state today. Majority Leader, you've been a champion for ensuring that as a community we're focusing on where we're going, not where we came from, and thank you for your championship of equality. But Commissioner Edelman and to Commissioners Caridi and Persicelli, the Murphy administration has been really accomplished in the nascent stages of launching our Get Covered New Jersey exchange and of the first phase of Cover All Kids. But this next phase is going to fill some critical gaps and visit violence on the nationwide practice of discrimination against innocent children of those without documentation of status. We don't have a system of health care in America. We have a system of health insurance, which is designed to focus on the denial, not facilitation, of access to care and treatment. Healthcare, although healthcare is a fundamental human right, until that system changes in our democracy, it is unconscionable that any child could go without coverage or health insurance because of family resources or immigration status. The global pandemic highlighted inequities in accessing care and how vulnerable communities and people without coverage suffered more illness and died at higher rates, but that's especially heartbreaking when it comes to kids, not just in terms of the triple-demic that we're facing in the confluence of the flu and COVID and RSV and mental health issues also that were exacerbated during the pandemic and the serious debilitating conditions and even preventive care and vaccines being out of reach for so many immigrant children. And while we invest in children's health and their development, we're also reducing unnecessary ER visits and saving taxpayers' money. As chair of the legislature's Joint Asian Pacific American Caucus, I have to note that children of color are uninsured at the highest rates, particularly Hispanic children and black children, at I think 10 and 6% respectively. The states that haven't availed themselves of federal resources to expand Medicaid have twice as many uninsured kids as expansion states. So thank you, Governor, since day one for always making sure that our state is at the forefront of expanding and not narrowing access to critical health care services. I am tired of looking fellow parents in the eye in my district and telling them that their child's life is worth less than mine because of congressional inaction on comprehensive immigration reform. And just to wrap up my thoughts, when I was 15 years old, I had to emancipate as a minor and was deprived of parental guidance between that age and a few years later because my father, who had suffered a pituitary stroke and several other debilitating conditions that resulted from the steroids he needed for his glands to function, couldn't work as an accountant anymore because of his health. He couldn't afford health insurance pre-ACA in 1998, 1999 without a job. And that vicious cycle forced him to return to his native India with my mom where they could afford treatment. And for 2 years until I joined the Marine Corps, I was without health coverage too, and I was one of the lucky ones. because I was able to work. And so I really think, for me, Governor, I think this should be one of the proudest days during your tenure in an office that I think you were called upon by God to serve and to lead us through the past few years of crisis. And I'm really grateful that you're doing the right thing and putting affordable health care in reach for families and children across our state.
Raj, thank you, man. There's nothing like lived experience, and God knows you've lived it. And thank you so much for your leadership, and Teresa, same in the Senate. And Joe Vitale, I want to add my voice to thanking him as well in absentia. Last but not least, I mentioned her earlier. She's a friend. She's a great leader. She's the executive director of the New Jersey Alliance for Immigrant Justice. Please help me welcome Amy Torres.
In keeping with the multilingual theme of both today's press conference and this program's outreach launch, magandang umaga and good morning. Thank you, Governor Murphy, for the kind introduction. And before I begin my remarks, I would just like to take a moment to applaud every immigrant family, every advocate, every parent, every child that fought for this moment. Thank you. And congratulations, y'all. We are one step closer to coverage and health dignity for all, starting with our kids in the most formative and vulnerable moments of their lives. Way to go. Congratulations. I'm with New Jersey Alliance for Immigrant Justice. I'm very humbled to be here today because I'm just one person in a broader coalition fight. I want to acknowledge New Jersey Citizen Action, New Jersey Consortium for Immigrant Children, New Jersey Policy Perspective, Make the Road New Jersey, Minquan Center, so many others, Wind of the Spirit, others who are both in this room and down the block and in the neighborhood and all across the state who brought us here. The Alliance is the state's largest immigration coalition, which may not sound that impressive until you understand that New Jersey is one of the most diverse states in the nation. By population, New Jersey has a higher percentage of immigrants than 48 other states. That makes nearly 1 in 4 people in New Jersey an immigrant. And over 40% of our children come from immigrant families. That is amazing. And we should be so proud of that. I am so proud of that as an immigrant daughter. Our history as a state is a history of immigration. It's a history of integration, and it's a history of making progress for everyone who comes here to call New Jersey home. This month, we are building on that history again by joining 9 other states in providing healthcare coverage to undocumented kids. So congratulations again, New Jersey. Immigrant stories are New Jersey stories, though the Statue of Liberty may sit on our shores. As the Assembly member mentioned, we are a very, very long way away from that golden era of immigration. It is more costly than ever to be an immigrant. Folks may, especially folks in this room, may be familiar with the refrain, well, my family came here the right way, right? But that right way doesn't exist anymore. DACA renewal fees, $500, over $500. Naturalization application fees, over $700. Many renewal programs are in the hundreds of dollars, and family sponsorship petition fees can sometimes be in the thousands. It's enormously costly to be an immigrant who wants to be a New Jerseyan permanently. But with this expansion of Cover All Kids, healthcare cost is one less thing that immigrant families have to worry about. Racial health disparities continue to persist in New Jersey, and by providing coverage for our kids in these early years of their lives, we are making bold strides to begin addressing these gaps, and importantly, making the investments in care and coverage that prevent the costly emergencies and crises that will happen further down the road. To truly realize our vision of becoming an opportunity state, New Jersey's public programs and services must grow to reflect the increasingly diverse families that call our state home. And we're moving in that exact direction with Cover All Kids. The fight for this campaign is a testament to the growing organizing power and strength of immigrant families. We must empower those very same voices to spread the word so that every other family with an eligible child feels encouraged and has the support and guidance they need to apply. Now, I know that we're all packed in here today. It can seem like a very small space. You can tangibly feel the warmth and excitement in the air. But it's places like this and places even smaller and even more in demand where enrollment and outreach happen. These are the neighborhood shops that happen in church basements, right? They're the community organizations that are struggling to make rent, and it's these community providers who have the cultural fluency, who have the language skills, and most importantly, have the earned trust to reach out to these families and make sure that they have the support that they need to enroll. Our work is not over. Governor Murphy said it himself. It's not some kids, it's not most kids, it's cover all kids. This bill is already law, right? We need to keep it funded, and the fight continues to make sure that the program is resourced in the budget, not just in this inaugural year of the expansion, but in every single year to come. And we also need to make sure that our government speaks the languages of our community so that they can access and enroll with ease. We need to make sure that there are protections for immigrants, like the ones that we already have in the Immigrant Trust Directive, codified into law, and we need to do more to understand our communities, particularly Asian American and Pacific Islander communities and Middle East and North African communities that are currently rendered invisible in state data. These are new programs and proposals, yes, but as Senator Ruiz said, please do not confuse these with new costs. Already, we spend too much as a state in untargeted outreach. We spend too much in preventable emergencies and crises, and in the most costly and damaging of all, we spend too much in losing human lives. We never ask how much it costs when a child misses an early diagnosis. We never ask how much does it cost when a playtime injury turns into a permanent disability. We never ask how much it costs when a sniffle turns into something like an emergency room visit. But we don't need answers to those questions to know that Cover All Kids is the solution and the right step in the direction we're moving forward. There are no silver bullets, but this is a big stride forward to work in concert with other programs and proposals to position New Jersey as a leader, not just as an opportunity state, but as a New Jersey for all. Thank you.
Thank you, Amy. Great job. Really well done. Amy, thank you. Really well framed, and thank you and all the other advocates for your leadership on this and so many other important matters. This is either the 5th anniversary or the first day of my 6th year as governor. So that's, Raj said, he could not imagine a day filled with more pride, and I would share that sentiment. But I also think Amy gave a little bit of a warning on the horizon. We have to make sure, and you guys will be around a lot longer than I am, and so many of you in this room, we got to make sure that the generations to come continue to step up to the plate every day, and that we've got all the bad behavior of New Jersey in our rearview mirror when we didn't make our pension payments, when we didn't care about equality, when we didn't reform criminal justice systems, when we didn't care about our immigrant brothers and sisters, particularly the kids. We have to make sure we draw a line that's bright, bright red, and we never slip back, because we have to remember always days like today where we're changing lives. Think about that, 16,000 kids. That's the Prudential Center, right, Tim? Full up for a hockey game. Just think about that. And then the families, the moms and dads and other uncles and cousins, this is a game changer. So again, I want to thank Mayor Tim Doherty for his great work as mayor, but also so graciously hosting us today. I'm not a Cincinnati Bengals fan, so I'm going to say I'm all in with the Buffalo Bills. Buffalo's had a rough year, so they could use a kick in their step. Sarah, thank you for your leadership. Majority Leader, Chairman, deep, deep thanks for everything you all do. We wouldn't be here without you. And Amy, thank you so much to you and all the other advocates. And lastly, Eva and Fran and the rest of the group here at Sioux Falls. I refer to this as an iconic institution, not just here in your Morristown location, but in this state. Keep up the great work, and thank you, everybody. Take care.